This is also a very interesting one because it's a collection of ASEAN countries. So I invite the Dr. Monika from the Ministry of Health, Indonesia. She will present as the first speaker of the ASEAN countries. Monika, please.
Yes. Good day, colleagues. I will share with you my PowerPoint. Okay. Could you see my PowerPoint? Okay. Thank you to have this opportunity to share some information. Maybe I will talk shortly and directly about community response to COVID pandemic in Indonesia. First cases announced on 2nd of March 2020, and since 16 June, the confirmed cases reached to 40,400, and the number of deaths 2,231. It's been 5.5% mortality. Right now, all of the province, 34 provinces affected to this COVID-19, but the number of districts affected 431. So it means that there are some districts not affected yet. And the local transmission affected in 128 districts. Okay, for the communication to reach to the community, we use some tools. First, we established a national guideline on prevention and control of COVID-19, and follow with another guidelines, and established task force for fast response to COVID-19. This task force acts as steering council and interagency coordinator and response for COVID-19. And communication, information, education using electronic and printing media, and also community engagement. We use strategy, risk communication, and community engagement. So national infection control strategy consists of prevent, detect, and respond for COVID-19. Is becoming the reference for health sectors on the field in addressing COVID-19. As we see in this slide, community response to prevention such as hand hygiene. There are hand hygiene movement at the community. We saw this picture, president and public figure give promotion of hand hygiene. Also, there are some activity by the community, such as hand washing facility made by citizens independently, and they're placed in the public area in their village. They provide also hot water and soap for hand washing prepared community for public use, and also community self-sufficient in supplying free hand sanitizer. For the community response to prevention using masks, awareness and compliance using masks in public places has not been spread evenly in the community. There are 1 million mask movement come up in the community as a response of mask scarcity and expensive price. Individual and group participation of the community, such as businessmen, public figure, artists, village volunteer, religious, and community leader in this movement are supporting government instruction to use the mask. Homemade masks are disbursed as a free to the community. For the community response to physical distancing, government instruction for the physical distancing has been responded by management of public facility. They provide some infrastructures, community practicing physical distancing, when there are arrangement and control in public facility. So the community response to physical distancing is varied. People that follow the suggestions generally has already realized the importance of doing preventive action. The influencer and social media has been actively participating to convey and persuade physical distancing, so that hashtag di rumah aja or stay at home become popular in social media. Community response in terms of quarantine and self-isolation has been done by community. They are following the instruction from health workers, but compliance in doing quarantine needs support from family and neighborhood. Neighborhood involved in supervising or giving moral and material support. In Indonesia, we not apply lockdown. We using a large-scale social restriction. This is applied in the area with increasing number of cases and with local transmission, such as in Jakarta. So a local government in the village initiating the participation of its community to conduct the restriction of in-out access to their neighborhood and to report any guests to the village officer. Essential social service during period of large-scale social restrictions. Study from home, school, so school are closed, restriction of office activities, minimalizing religious ceremonies and events that takes place in public facilities, so church and mosques are closed, transportation restricting, limited number of passengers at car, bus, train passengers up to 15%, 70% less than normal, commercial flight only to carry logistic and for duty purpose. But health facility, supermarket, grocery store, gas station still open. Physical distancing has caused part of community lose their job and reduce their income. So the situation encouraged for the emerging actions such as solidarity and raising donation to the people who's affected financially in any way. The initiative for the action comes from various elements: local government, community group, religious group, philanthropy, public figure. One of the sample action that raising donation by musical concert via national television with theme "Stay at Home" was very successful, brought people sympathy in sharing. In village level, various solidarity action has been conducted also, such as providing public kitchen, food for affected community. Family welfare empowerment team, this is a volunteer in the level of village, was participating actively in this action, such as solidarity, shows collaborations, participating actively for public kitchen provide. So college, such solidarity shows collaboration spirit that become Indonesian culture, currently become one of our strengths in addressing COVID-19. But we have also facing some situation and challenges. New cases COVID-19 are still high currently. Restriction is still applied in epicenter area in Jakarta also, but it will be adjusting by epidemiologic condition of cases later on. Economic sector has been reopened gradually. So people must adapt with the new normal by following health protocol in their daily routine. So that's it, my talk. Thank you very much for your attention.
Thank you very much.
Yeah.
Thank you very much, Dr. Monika. Yeah, your presentation is very covering a lot of areas and is catching the time as well. Thank you very much.